maybe COVID could be a long-term disability for some people. They seem to be getting, long-term COVID. They might be over the initial COVID, but they still feel the effects over time. Obviously, pain as well could be non-visual disabilities. Arthritis, Lyme disease, migraines, fibromyalgia, all these chronic health conditions that may disturb the hair cycle. So this is the skill of being a trichologist. This is what I was saying earlier, the consultation, how important the consultation is. For you as trichologists to do a full case health history in the initial consultation, you should be spending 30 to 60 minutes in your initial consultation, plus maybe the same length of time in any follow-ups to that, particularly if you ask your client to see a physician, maybe to get blood tests or whatever you might need, because you have to ascertain what health issues could be important for that individual that you are consulting with. Also, if they're medicated, that is also another factor that could be disturbing their hair cycle, and it's something I'm going to go into a little bit in a minute. Also, the advantage of, I believe, of the trichologist over any other discipline, including dermatologists, is that we also deal with cosmetically improving the hair. Because if they have a chronic health condition that can't be cured, or they're taking a medicine for long term and it's affecting their hair cycle long term, okay, you might be able to help stabilize it, you might be able to help slow it down, the hair loss. You might even be able to get a little bit of regrowth. But ultimately, you want it to look good. When they look in the mirror, yes, they want it to look good and they feel a lot better about themselves. And that is our advantage. Yes, we can help with the hair loss itself, but we can also help with the cosmetic improvement. And sometimes, if we go back to what I said earlier, it could take 3 months for the hair to get better with treatment because it took 3 months for it to fall out after the trigger occurred. Then why not make their hair look as best as it can look? Hair or scalp problems can occur post-surgically. Now, this could be due to the surgery itself or the reason why they had surgery in the first place. There are 4 types of anesthesia. Again, the more systemic the anesthesia is, the more likely it is to cause telogen effluvium 6 to 16 weeks later. Remember, 3 months, but always have a larger window, 6 to 16 weeks. So there's local anesthesia, which is just a small area. You stay awake. There's the intravenous, the IV, which is mild, just to relax you. You stay awake, but sometimes you don't remember what they did. There is the regional anesthesia, which is a whole area, such as an arm or a leg, like an epidural. And then, of course, there's the general anesthesia, which affects your whole body and you sleep through it. Now, each one could potentially cause some hair loss, but you're going to find the general anesthesia and to a lesser extent the regional anesthesia, they're going to more likely lead to temporary or telogen effluvium if telogen effluvium is going to occur. Those are the 2 that would be the main trigger. Now, medications, this is probably the most difficult one for you as trichologists to work out because, one particular medicine can cause hair loss for one person, but it might not cause hair loss on somebody else. And different medicines react differently in different people. So, you might be taking medicine A and you're losing hair, and a friend of yours might be taking medicine A and not have any problem at all. So often it is individual effects that cause the hair to fall out in some people and maybe not so much in another. As I was saying, taking medicines can cause hair loss in some people, while the same medicine may not cause hair loss in others. Stopping a certain medicine can cause hair loss in some, but not in others. Also, taking that a step further, changing the brand or changing the dosage can cause hair loss as well. Also, certain medicines, if it's not complicated already, this makes it even more complicated. Certain medicines can cause hair loss the first time they're taken, but not subsequent times because the body adjusts to the medicine. Or they don't cause hair loss the first time, but do subsequent times because the hair, because potentially the medicine is accumulating in the system. So there are many different variables, and you really need to do a thorough consultation to find out what medicines they're taking, when they started those medicines, if the dosage changed, when did the dosage change, when did they start seeing their hair falling out more, is there an association between the medicine and the hair loss? Of course, going back, it could also be, well, why are you taking the medicine in the first place? Because that could also be a trigger as well. So it's the skill of the trichologist to find out all those answers. Trying to ascertain if a particular medicine may be influencing your client's hair, it is important to find out when they started or stopped the medicine and see if the hair loss started 6 to 16 weeks or 3 months after the fact. And as I said earlier as well, it's possible that the condition the medicine was taken in the first place could be the culprit. or both the medicine and the illness could be the culprit. So these are just things to keep in the back of your mind. And sometimes you want to, like, you get their information sheet and you Google what some of the medicines that you're not quite sure about what they do, and then that also gives you a clue. And also, you could look to see if there's any information that that medicine can cause a hair loss before you even see the client. So it gives you an idea of that. Medicine A, can cause hair loss. It's been reported, and at least I know medicine A is for this type of condition as well. There could be interaction between certain medicines, but there could also be interaction between supplements and medicines as well. And a lot of the time, nobody even knows if there's going to be an issue between them. I would always suggest that you take supplements at a different time to take in any medicines to at least reduce that possibility of interaction. The medication type. So just here I mentioned chemo medicine. This is some of the medicines, because they stop the cellular turnover in the hair follicle quite quickly. Because don't forget, chemotherapy is meant to stop the cancer from replicating. So therefore, it's going to sometimes affect every fast replication cell in the body. And the hair is one of the fastest replicators in the body. So it can affect the hair cycle. And this can actually cause anagen effluvium because the hair can stop in anagen and fall out from anagen. It wouldn't even necessarily go through the calagen and telogen phases. They can also produce changes in hair texture, hair type, and pigmentation. So it could be, what I mean by hair type, if it's curly hair or straight hair. A lot of people say their hair, is more curly after chemo or less curly after chemo or whatever. And it might change some of the hair follicle actions so that you do get different pigments, you get different textures, you get curliness or straightness, if you like, because of that. And these are just sort of some of the agents that can cause hair loss. Some are more likely to cause hair loss than others. But what I've done in the next slide is put chemotherapy medications. Now, there's a lot of aromatase inhibitors that are prescribed, particularly for breast cancer. Simple ways that I've come up with trying to remember what this enzyme does. It begins with the letter A and ends with the letter E. So aromatase is an enzyme that changes androgens, which are male hormones, into estrogens, which are female hormones. So if you're changing androgens to estrogens, given that androgens may potentially cause more genetic hair loss, then you're reducing the amount of androgens in the skin. But if you have an aromatase inhibitor, it inhibits the aromatase, therefore you are having more androgens in the skin because they're not being converted to estrogens. Because in breast cancer, you don't want the estrogens. And these three here are the most common types of aromatase inhibitors. But then there's a very well-known chemo drug called tamoxifen. I believe it's called the same worldwide, but I'm not 100% sure. And this, I just wanted to explain, tamoxifen is not a aromatase inhibitor, but aromatase inhibitors can cause fewer side effects because tamoxifen is more like stroke and aromatase would be more like broken bones, osteoporosis, because there's less estrogens. But aromatase inhibitors are more likely to cause hair loss because it's reducing the amount of androgens that are changed to estrogens. So always, if you have a chemo patient, always try and find out what type of chemotherapy medicines they have been taking. So other types of medicines that can cause hair loss are antidepressants, particularly lithium-based. They can disturb the hair cycle. I know I said I wasn't going to mention hormones, but thyroid medicines for either underactive or overactive thyroid can cause hair loss. Now, a lot of people have said it's the thyroid medicine that's causing my hair loss. And I say probably not. It might be a little bit. But if your thyroid is too active or underactive, that will tend to cause the hair loss. But if you take a thyroid medicine, which balances your thyroid, 6 months later, it shouldn't affect the hair cycle quite so much. And when you first take thyroid medicine, the physician will vary the dosage until the balance is found. So this is why people think it's causing hair loss, because while it's being balanced, then 3 to 6 months after the dosage has changed, the hair will begin to fall out, and that dosage will need to be stabilized. And then 3 to 6 months after that stabilization, the hair will tend to improve. So again, this is a little complicated. Is it the thyroid medicine or is it the thyroid problem itself? I personally believe it's mainly the thyroid problem itself, because once the medicine is corrected and is balanced and has balanced your thyroid, the hair loss tends to improve or at least not get worse. Is that 100% no? But it is, I think, a pretty good rule to go by. Again, another hormonal thing, but the contraceptive pill. And by the way, people don't look at the contraceptive pill as a prescription medicine. So it's good when you're doing a consultation to specifically ask. If you're saying, "Oh, you want any prescription medicines?" and they say no, and it's female, you would say, "How about the contraceptive pill?" Or, as in Sergio's example, "Are you on any hormone replacement?" Because people don't look at those as prescriptions, but they are. So stopping or starting the pill can cause hair cycle disturbances because of the hormonal level. And again, this will be discussed later when we do the hormone chapter. Other groups of medicines that can cause hair loss: blood pressure, beta blockers, cholesterol, ulcers, gout, arthritis, anticonvulsants for epilepsy. A lot of these medicines have been known to cause hair loss. Again, is it the medicines or is it the condition that the medicines are treating? Probably a bit of both. And next time, I'm going to go to part 2 and talk a little bit more about stress.